concerns about the deadly coronavirus officially.
The news spreads of China's mystery illness.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
And so far, we have lost nobody to coronavirus in the United States. Take it easy, just relax. Relax. You're doing great.
Depois da facada não vai ser uma gripezinha que vai me derrubar, não. Tá?
I can tell you that I'm shaking hands because I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody.
From this evening, I must give the British people a very simple instruction. You must stay at home.
Almost 1 year ago, a pandemic virus emerged that has altered our way of life. Despite the danger, we have returned to where COVID-19 is believed to have originated. In February, Animal Equality conducted an undercover investigation to expose how animals destined for consumption are raised and killed in wet and traditional markets in Asia, and revealed how these markets are a risk to human safety.
I think the greatest difficulty at the beginning of the pandemic was just being one of the very first to be hit. So we needed to write the book as we went along.
Korea tried to strike a balance between control and prevention measures and our people's daily lives. The first case of COVID-19 in South Korea was confirmed on January 20th. The KCDC created a task force to monitor the COVID-19 situation. At the same time, we enhanced a broad screening process to block the inflow of COVID-19. Korea studied and analyzed the virus and began to develop testing kits.
We built up this example. The three T's, the testing, tracing, and the treatment, are just the very basics of any disease control.
We have been able to pursue creative strategies, including the drive-through screening stations, residential treatment centers, and the non-face-to-face healthcare services.
Some look at the Korean case and say, oh, you have the IT infrastructure, you have the universal health coverage, you have the ingredients to be successful. But I think they're missing the most important element in this, which is the public's trust. Crisis response can be successful only if you are faithful to the fundamental values of your country. And those fundamental values of our very vibrant democracy is exactly openness, transparency, and full government accountability.
Korea supports the Access to COVID-19 Accelerate initiative led by the WHO and will actively take part in international effort to develop and distribute vaccines and treatments.
I think we all know now COVID-19 is here for the long term. We have to live with the risk and manage the risk while ensuring and enabling the people to move about and respecting their fundamental human rights.
Overwhelmed hospitals, people dying on the streets from lack of oxygen, and packed crematoriums. This is a snapshot of the COVID-19 crisis in India. In contrast, just a few months ago, the Prime Minister declared victory against the pandemic.
उस देश ने कोरोना पर प्रभावी नियंत्रण करके पूरी दुनिया को, मानवता को बड़ी त्रासदी से भी बचाया है.
After that, there were political rallies, mass gatherings, and religious festivals, like this one. And then on April 21st, the country reported a record number of COVID-19 cases in a single day. And those numbers kept growing for several weeks, with many health experts saying real numbers are likely much higher. By May 7th, deaths soared past 4,000. As COVID cases in several Western countries have trended lower, the scale of infection in India and a new variant first reported there have alarmed the rest of the world. Here's how India became the world's COVID hotspot, and what that means for the global pandemic. First, we have to go back to early 2020. As much of the world was struggling to contain the virus, India appeared to have things under relative control.
आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है.
Early on, Modi announced the world's largest lockdown in the country of 1.3 billion people.
He publicly came out multiple times and said, we have to pull together, we have to wear masks, we have to socially distance. There was a lot of respect for COVID restrictions, and people were also scared.
The measures triggered a mass migration of workers trying to get back home from cities. Epidemiologists warn that this movement of people could help spread the virus undetected to other parts of the country. India was doing very well compared to the US or the UK. And that's when Modi touted the country's success in front of other global leaders at the World Economic Forum.
जो अपने ज़्यादा से ज़्यादा नागरिकों का जीवन बचाने में सफल रहा है.
So what went wrong? Public health experts blame India's ferocious surge on a combination of new factors. The first one, people became more relaxed about COVID safety measures. Many people stopped wearing masks, and there were several crowded gatherings, which public health experts say may have been super spreader events, including huge political rallies. April was a key election month, and political parties, including Modi's BJP party, organized events across the West Bengal state. A BJP spokesperson said that no one had anticipated the magnitude of the COVID-19 surge, adding that Modi and other members of his party followed all the safety protocols in place at the time. Right around then, resources to fight the pandemic weren't reinforced or maintained.
Everyone essentially thought that COVID was over. By January, hospitals were taking down their COVID-19 wards. Testing centers that had been started last year were also being dismantled.
And on top of all of this, highly contagious variants that were first identified in the UK and South Africa were circulating in the country, as well as a new variant known as B1617 that originated in India.
The 617 in India, it's a wily opponent.
The WHO has said preliminary studies indicate that this one may be more contagious than some other variants, and has since been detected in more than 40 countries, including the US, UK, and France. This has added urgency to the global vaccination race, which has so far helped cases plummet in some of those countries. So even as the COVID situation has improved in some parts of the West, the fight against the pandemic across the globe is far from over.
A big lesson is just countries can't get complacent. And even if one country is doing well, if another country is not doing well in terms of COVID, that will affect every other country in the world too.